West Virginia University Center for Excellence in Disabilities. The Paths for Parents project is funded by the West Virginia Department of Health and Human Resources, Office of Maternal, Child, and Family Health, Children with Special Health Care Needs Program. Circle of Parents Group. To find out more about the Circle of Parents Group or the Paths for Parents program, please visit our website at www.cedwvu.org. In this discussion, a peek inside WVU Children's Hospital Neurodevelopmental Center with special guest Dr. Jenna Wallace from the WVU Behavioral Medicine and Psychiatry Department. Special guest Dr. Jenna Wallace and your host, Tina Crook.
Hi, everyone, and welcome. My name's Tina Crook. I'm a Family and Parent Network Specialist with the Center for Excellence in Disabilities. Tonight we have my coworker Sherry Gothard Barron with us and Dr. Jenna Wallace, pediatric psychologist at the VU. We've got some of the top questions that we get asked by parents about the Neurodevelopmental Center and some kind of psychology related issues. Dr. Wallace, would you like to take a moment and kind of introduce yourself and tell a little bit about your profession before we jump straight into the questions?
Sure. Thank you for the introduction and for having me. My name is Dr. Jenna Wallace. I'm a pediatric psychologist at WVU Medicine, where most of my clinical time is spent over at the Neurodevelopmental Center, like Tina said. And I'll talk a little bit more about the center as we go on. I did my graduate school at Marshall University, and so I've been in West Virginia now for about 10 years. And I live here in Morgantown with my family and have really loved being a part of the WVU School of Medicine.
Thank you, Jenna. Okay, so the first question that we have are, what are some of the reasons a person would bring their child to see a psychologist?
That's a really great question. And I love this one because I think it's important for parents to know, first of all, that if a psychologist walks into your room at a well child visit or at another visit that your child is at, it doesn't necessarily mean something's wrong. So there are psychologists doing all kinds of work in the pediatric realm, ranging from primary care, where we help parents learn how to potty train their kids and deal with tantrums, to psychologists who work in the assessment world, which is a lot of what I do, looking at kids and trying to help find the appropriate diagnosis for them, school psychologists who work at making IEPs and helping with behaviors or mental health problems in schools. And then there are child psychologists that help with the more traditional things that you think about, which are like depression and anxiety, mood disorders, suicidal behaviors. So there's a really broad spectrum ranging from the completely normal things of childhood all the way to the most scary and severe things of childhood that can occur.
Okay. And just real quick, I know this wasn't on our question list, but I know for a lot of people, it can be confusing, the difference between a psychologist and a psychiatrist. So can you explain that a little bit, what the difference is?
Yes, that's also a question that we get a lot. And so it's important to know that it all starts with training. And the background in training is that psychiatrists go to medical school. And then after they finish medical school, they specialize in psychiatric conditions, mental health, and behavioral health. Oftentimes in our state, they are prescribing medications for kids, but also have good skill sets in working from a therapeutic perspective, just depending on the practice. Whereas psychologists go through graduate training to work on those modifications of behaviors and mental health. So tend to be more in the research and therapeutic world, also do a lot more of the psychological assessments like cognitive testing and neuropsychological testing. So we do a lot of overlap, and a lot of people like to kind of think of it as psychiatry doing medication and psychology doing more of the therapy and assessment, but there's certainly overlaps between the two, and we do work closely together.
Thank you for that.
Mm-hmm.
Okay, so let's see. Can you tell me about the Neurodevelopmental Center? Like, who does it serve? What services are offered? And do people need to have a referral?
Yes. So the Neurodevelopmental Center, and if you've been in West Virginia for a while, you may have heard of it referred to as the Klimberg Center. But the Neurodevelopmental Center is the physical building that we exist in. It opened in 2018. And it is a multidisciplinary clinic that serves kids primarily ages 12 and under, although there are certainly some exceptions to that. And we have 3 branches. So the first branch that I work in is our medical team, which includes pediatric neurology and psychology. Our neurologists are also neurodevelopmental specialists, so they've spent extra time training in neurodevelopmental disorders, but they also manage neurological issues like seizure disorders, neuromuscular disorders, and other things like that. Our psychology team does a few different things. So myself and Dr. Claire Bannock, we do assessments of kids up to age 12. We also do some therapy, limited therapy services for families and children, and then also do behavior consultations. So when families come in to see neurology, we check in with them, see how things are going, and see if they need any behavioral health care or school recommendations. So that's our first branch. Our second branch is our intensive ABA therapy clinic. And so ABA, or applied behavior analysis, is the gold standard treatment for kids with autism. It really works for everyone, but it's predominantly used for kids with autism in our state. And that clinic serves mostly preschool age kids who come for intensive therapy services, which means that either in place of or in addition to their preschool services, they come for multiple hours throughout the week. So they might come for multiple half days or for full days, full time, depending on their needs and the availability of the service. So that kind of looks like a preschool program, which is really cool because we have lots of kids running around. It's always fun, lots of noises and laughter. And then our third branch is our intensive rehab therapy. So that's occupational therapy, speech therapy, and physical therapy. And we have at least 2 providers for each of those. And they stay very busy and also do really great work. So the next part of that is that we've just expanded the clinic. So the first half of our project started in 2018, and our medical director, Dr. Lindsay, works closely with hospital administration to build out the second half of our building, which means more providers in all of those areas and growing services, which is really helpful for our state. In order to be referred for any of those 3 branches, you will need a referral from your primary care doctor. And so if you're looking for therapy, they can specifically place an order for that. If you're looking for assessment or neurological care, they can place a separate referral for that.
Thank you. So the next question, which I think you may have just answered it, is can you give me more detail about the Autism Services, what all services there is? Is there more than what you just mentioned?
So I kind of hit on all of the things, and it's important to know that every kid with autism is different and has different needs. So traditionally, a care team for a young child with autism might look like their ABA therapy team, their medical team, and then a combination of speech, OT, and PT, whatever they specifically have needs for. So that's the primary services that we offer. And then for kids with autism who are evaluated at our medical clinic, we do follow them closely. So just because you've been diagnosed with us doesn't mean that you're then kind of set free unless you want to be. But we typically follow kids every 3, 6 to 12 months, depending on their needs too. So we see them pretty frequently.
Right. So when can a child be diagnosed with autism? I mean, I know it's not something that, they're born and, oh, we know they have it. So usually when do them warning signs start to pop up, and about what age or how long from those red flags can a diagnosis be given?
So by age 2, we know that diagnosis tends to be very reliable. So by the time a child is 24 months, we can reliably say whether or not they have autism in most situations. But the first signs and the first symptoms that come up for parents really varies. What we typically tell parents is as soon as they're walking, we can start to get a really good idea, because the tests that we use are validated only on children that have started walking, because we know there are big bursts in social skills and communication once a child is up and moving around and able to kind of look up at us and live on our plane of existence. So around 12 months, we can start to diagnose kids and start to see those symptoms. Sometimes we'll want to see them back in 3 months just to make sure that we're not missing anything. There's a caveat there. If your child is older than 2 and is not yet walking, we can still certainly see them. And some kids can be very reliably diagnosed if they're delayed walkers. But 12 months is a good time that if you're having concerns as a parent and you want them to be evaluated, we will certainly see them. And most families will, between that 18 to 24 month mark, will be able to reliably diagnose.
Thank you. All right. So next, how do children benefit from psychological treatment if their minds are still developing?
Yeah, I think that the answer to that is because their minds are still developing, they are so eager to learn new things. And we see that in positive and negative behaviors that children are learning every single day. And when a psychologist is involved, even in those early ages, it's involving the parents in the care that's the most effective. So making sure that we're teaching parents the ways to manage problem behaviors, to reinforce positive behaviors so that we'll see more of those, and to also teach some of those early coping skills, like being able to manage your own anger as a parent is a really good way to reflect that for your toddler who might be throwing tantrums. Being able to use your own positive coping statements like, this is hard, but I can do it, is a really good way to teach your 4-year-old how to be able to go through that. And so it's important for families, especially adults who maybe haven't started therapy until they're older. They might think about it in this long-term, going to go sit on a sofa and talk to somebody for a long time, for years, we're going to be in therapy. But for kids, we really tend to be very problem-focused and working with families to try to help make their child successful from the beginning. It's important not to wait. If you think that you need help now, the earlier we can intervene, the better the outcomes will be for kids.
Right, right. Okay. So what does therapy or psychological services look like with children?
Yeah. So if you've ever seen speech, occupational, and physical therapy, I have a lot of parents that will say, well, they went in and played with me or played with my child. And sometimes it can be very purposeful play. What's important for parents to realize is that if their therapist is playing with their child, the parent needs to understand why that play is happening and what they can do at home to continue that on. So I might be playing with a child, but during that time might be kind of talking about different feelings, different ways to cope with stressors, bringing out kind of questions that I have about them and how they're doing, or trying to get a better picture into what they're thinking. So it can look like play from the outside, but it's really intentional and purposeful. When you're a parent of a young child and you're getting therapy, like parent-child interaction therapy is one of the gold standard treatments for kids who have disruptive behavior disorders. That is a lot like parent coaching. And so the therapist might be observing you with the child, giving you pointers on how to help them in the moment when those problem behaviors occur, and then helping you to be able to make that sustainable so you can take it home. Now, for older kids, depending on their cognitive skills and their language, it's also working on helping them build a toolbox of coping skills that they can carry with them wherever they go. So if it's managing their depression, we might work on what are some activities that you enjoy that you can schedule into your daily life rather than laying in bed or playing video games. Can you go outside and go for a walk? And really that problem solving with them, as well as if they're maybe anxious or depressed, helping them identify what kind of thoughts are making them feel that way or what their feelings are and how they might spiral, and then being able to teach them coping skills to use. So from the outside, it can look very different depending on what the child needs, but the predominant factor is making sure that it's tailored to their needs and that parents understand what's going on.
Right, right. Thank you. I know makes it so much easier when the kids enjoy it. So, you got to have that in there. And I totally understand and get that, from the outside, it may look like fun time, playtime.
Yep.
But yeah, you're able to, still help that child and teach that child, help them to cope. And yeah, so yeah.
Yeah, and there are some kids who come in and they have a specific thing that they want to work on, and they know, even young kids, I have 9-year-olds that are like, I feel very anxious, this is the problem. And then you might have a 14-year-old who isn't really sure why their parents want them to go to therapy. And it takes a lot of building that relationship between the therapist and the child before any progress can be made. So sometimes you don't see immediate results, but my biggest advice to parents is always know what the plan is and know that there is a plan so that you guys are all on the same page and working towards the same goals.
Thank you. Are there services for the parents at the NDC Neurodevelopmental Center or?
Yeah. So especially in the medical clinic, I would say a lot of the intervention that we provide is geared towards parents. So a lot of parent coaching, a lot of working on positive parenting practices, helping parents advocate for their child, whether it be for school or other services that they need. So in those medical visits, a lot of that attention is given to the parent and the child together. We also, before COVID, started doing a parenting power group, which was for families of kids, young kids who had recently been diagnosed with autism, and bringing them in for kind of social support and being able to learn different things about their autism diagnosis. But unfortunately, because of COVID, we've not been able to run that group again in 2021 yet. So we hope to be able to do that soon and to really build up the parenting or the parent focused interventions that we have.
Are there mental health clinicians who specialize in disability related issues other than autism there?
At the Neurodevelopmental Center specifically?
Yes, ma'am.
Yes. So currently we have 2 full-time psychologists, which is myself and then Dr. Claire Bannock. And Dr. Bannock has been really working hard to build up our therapy services. And so that ranges for kids with all sorts of neurodevelopmental disabilities and age ranges too. And she's doing individual therapy with them. And then we also have intentions of starting up group therapy and social skills training for kids, regardless of diagnosis. I also have graduate students that work with us that tend to do more therapeutic services too. We have one right now that has a caseload of therapy patients. So we're definitely trying to build that, and that will be part of our continued expansion.
Well, that's great. Okay, so what should parents know about their child's development that maybe you see often, or questions that you get as far as that, where they're just not sure maybe?
Sure. Yeah. I think my biggest advice to parents is trust your gut. If there's something that you feel like isn't going just the way that you think it should developmentally, or you see something that's different about one of your children than the other, or your children versus their preschool mates or other kids, it's better to self-refer to Birth to 3 or early intervention if you're outside of West Virginia, or to find your primary care doctor and say, listen, there is something different. I need you to help me. It is always okay to advocate for your child, always okay to push for the things that you think that they need. Because 9 times out of 10, I have parents that will say, I knew there was something going on. I knew I needed help. And everyone kept telling me to wait and see. And that's a really desperate feeling, speaking as a parent, to have, where you just know there's something that you need help with, but you're not sure how to make the pieces fit. So find your allies, find the people around you who can support you and cheer you on, and then keep moving forward. That's one thing. The other thing is parents want to know about kind of normal developmental milestones. Like, for example, for kids with neurodevelopmental disabilities, they want to talk about potty training, and they want to talk about some of those other more kind of basic developmental tasks that we don't think too much about until it's a problem. And I always advise parents to seek out help in those situations as well, rather than thinking we can conquer this on our own. If every kid was given to us with a manual saying, this is the way they need to be treated and this is the way that you can help them, that'd be great, but that just doesn't happen. So I think even for the smallest things, go ahead and ask for help. It might not be a psychologist. It might be, a friend who has a child who's similar. It might be a pastor or somebody else that you can find support through, but go ahead and seek that out.
I really appreciate that response, because through our program at the CED, we'll get referrals, and I couldn't tell you how many times that I've heard a parent say, I knew something wasn't right. I knew something was wrong, and it took, this long before, somebody would listen to me, or, and you're right, trust your gut. I really,
Yep.
really, really, really like that. And I kind of go with that too with the parents. How do you feel? Trust your gut. What's your gut telling you? So
Yeah.
yeah, I appreciate that. And I'm a mom. I'm a mom of four, so I've kind of been there, done that. You just have those gut feelings sometimes. Something's not right, and don't be afraid to reach out for help whenever you feel that way. So
Absolutely. And I always tell parents, there might be an expert in that area, but you're the expert on your child. And so you know that child better than anybody else in the world. And it's important for you to be a team in order to move forward. Just because your doctor, or just because the teacher or somebody says everything is fine, if you have that response, you're the expert on them, and you can kind of inquire further or try to find the appropriate supports. And I'm so happy for all the services the CED provides across the state, because we constantly refer families to you guys for resources and to have that opportunity to talk to somebody and get connected.
well, thank you. And we appreciate all the referrals that we get. We love helping the families. I know with the Pals for Parents program and the family to family, all of the employees there, we have a child of our own that has some type of special need.
Mm-hmm.
We've kind of been there, done that, and we're at that point in our life now that, we want to reach out. We want to help these parents, and we don't want them to maybe be stuck in that rut that we may have been stuck in.
Mm-hmm.
We want to give them the resources that maybe we were never able to find. And so it makes a big difference. And like I say, we greatly appreciate any referrals that we get. And I know that goes for every program at the CED. So,
Yes. Yeah.
all right. So what are some warning signs that parents should look out for, which may signal that the child needs some mental health services?
Yeah, so I think that varies depending on what kind of mental health services that we're kind of thinking about. But if we're looking at kind of depression, anxiety, or more of those internalizing disorders, I always encourage parents to look for changes in their functioning, whether that be they're sleeping more than they used to, or they're sleeping less than they used to, they're less or more hungry than they used to be, the things that they used to enjoy they don't quite enjoy as much, they're a lot more irritable or easily set off. Those are some big red flags for us that something's just not right. All of us have periods of anxiety. All of us have periods of feeling sad, especially after something happens, like a major life event. So it doesn't always mean that there's something that's going to be wrong for a long period of time. But tuning into that, being able to talk to your children about their feelings is a really important first step for some of those internalizing disorders. Externalizing stuff, so if your child is acting out, if they're being aggressive, they're talking back, they're getting in trouble at school, I think those are easier to catch for a lot of parents because they feel that stress too. And if you're having that stress response where you feel like you're tiptoeing around your child all day and you're waiting for the next explosion or the next note home from school, that's a good indication that it's time to get some help. For your child's sake and for your own, because it's hard enough to be a parent, and it is way harder when your child is having externalizing behaviors. And then when it comes to developmental differences, oftentimes those happen in the early developmental period. So if you're seeing that your child's not meeting their milestones at their well child visits, if they're kind of flagging on those questionnaires that your primary care doctor is asking, then that's a good time to go ahead and get help, even if you are kind of on the borderline of whether or not your child is delayed. But you can always self-refer to West Virginia Birth to 3 and get a free assessment done, and there's no risk there. They come to your home, they do it for free, and you can kind of explore further if there are developmental concerns. If there's more severe mental health issues, so we're thinking about suicidal ideation, or if your child's hearing voices, those are big red flags. If those things are happening and you're concerned, go ahead and seek immediate care for those. If your child is expressing that they want to die, that they've considered killing themselves, Those really more severe symptoms should not be postponed, or you shouldn't sit on those. Seek help immediately through the emergency department or emergency mental health services.
Thank you. Okay, so since COVID is the big thing right now, I'm going to jump to a few COVID related questions.
Sure.
So, has social restrictions and the virtual learning that we're seeing a lot of that are caused by COVID had an effect on the mental health of children? Have you seen maybe a decline or more, just ended up with more kids at the clinics because of mental health related issues that are related to COVID?
Absolutely. I mean, that is a definitive yes. We're seeing that in the research that's coming out in COVID. It's not just kids, it's their parents too. It's their teachers, it's their professionals that work with them. Everybody is under extreme amounts of stress. Kids have had big changes, and they have variable coping patterns or supports to be able to help through that. We have spoken a lot about at the Neurodevelopmental Center. It seems like the acuity or the severity of the patients that we are getting referrals for is higher. So a lot more of those disruptive behaviors, right, where the child can't function in the home because they're really distressed. And we really worry about the kids that are being missed, the kids that we typically would get. So we would typically get kids who are a little bit anxious or maybe struggling a little bit in school. Whereas right now we're getting a lot more of the kids who are in significant distress. And I think that's the pattern that mental health providers are seeing across the country, where mental health facilities are overrun, providers are completely booked, and it's really challenging to get in. And that's a good indication to us that mental health is not doing well. So it really at that point becomes a part of the community's problem, where as a community, we have to think about systems and ways to support our children, and think about ways that we can help parents to be able to get through these times. Because and we talk about that a lot with our outreach and the things, even like this, if we can reach families and help them in any way during COVID, that's what we want to do, and try to meet them where they are, even if it's just checking in at a visit briefly to say, are you doing okay? Because it's really hard.
Okay, so the next question, which I think was basically answered by the one you just answered, have you seen a rise in depression among children since COVID restrictions went into place? Which I think you kind of hit on that, that you have. So we can, the question after that I have is, have you noticed a difference in the mental health effects from COVID that we're seeing from COVID? In like, what's the difference between, I'm trying to think how to word this, teenagers versus maybe a younger child? How are you seeing it affect one versus the other?
Sure. That's a really good question, because there are some factors that can be protective or helpful for one group that are not necessarily as helpful for the other. So for young elementary age students, they might not rely as heavily on their peers for support. They might rely a lot more on their parents for support or their siblings, which for families that are doing okay, is a really good thing. So we see a lot of families right now where the child isn't really having that much trouble adjusting to COVID because they're home with their parents and they have their siblings, and sometimes their stressors are even less. Even a lot of the kids with autism that we're seeing, they don't have to go out as much. They don't have to go to school. They don't have to listen to all the loud noises when they go different places. So that can be good in that way. But if the family's not doing so well, if the family is struggling financially, if they're struggling with their own mental health, or there's a lot of stuff going on, a lot of stressors in the family, then that can be really challenging for all kids, but especially those school-age students who really rely on their parents for support. The same thing on the other end of the spectrum for adolescents is that, one of the protective factors for them is that because a lot of them have phones, they can stay connected to their friends, they can stay, on their social medias and understand what's going on in the world. But we also know that can be a huge area of stress for them. So they might be doing things online, spending too much time online, getting sucked into issues, and isolating from their families because they do rely so much on their peer support that can be harmful for them as well. So there are differences between the age groups, mostly depending on kind of where their developmental age falls, because there can be 16-year-olds who kind of function more along that realm of 10 or 11 with their social needs. But it also really bears down to the amount of family and community support that a child has during this time. And we know that it's hard on families. We know that parents are all trying their best to get through this, but COVID has had different effects on all of us, including a lot of financial troubles, especially in our state. So very aware that that's a problem.
Right. Yeah. And my two youngest children are, well, 18 and 12. The 18-year-old, he moved out in the summer to go to college, to get ready for college. But before he had moved out, we were already in, the shutdown, part of COVID, and, nothing face to face and all these restrictions in place. And while he was still here, he was always that child that, yeah, he had his phone, he had his social media, but he spent time with mom. We'd watch movies together, or we'd do things like that. And what I noticed with him was that he basically retreated to the bedroom, and it was the phone constantly. He had to keep up with what, everybody else was doing, because he was missing that, he was able to get out and do that. And I've noticed that with my daughter too, but which, at 12 years old, that's where, I got to put my foot down and say, hey, the phone ain't going to be attached to you 24
Yep.
But yeah, it's been stressful for, I don't think there's anybody that it hasn't been, stressful for. And, we do the best we can. And like you say, if it gets to where, it's becoming severe, then, definitely, don't be afraid to reach out for help. So.
Yeah, and it's important for parents to know that and to feel that sense of community that we're all really struggling through this, and perfection is not necessary. We do not nobody expects you to be a perfect parent. In these times, it's really helpful to be transparent with your kids. I know I've had a lot of conversations with my 7-year-old of, mommy's not perfect. I'm sorry that I snapped at you. It has been a very tough time, and trying to have those conversations to show it's okay that you're not perfect, because guess what? I'm not perfect either. And so really offering yourself grace in those moments of challenge or weakness, but then rallying back and realizing that you're the support that your child needs during this time. And for some kids, you're the only one they have. And so you got to take care of yourself, as hard as it can be as a parent. You got to try to do things that will help you manage your own anxiety, your own depression, or whatever else is going on with you, and be there for them, so that they can be there for you too.
Absolutely. Okay, and so the last question that we have is, what tips would you give to parents to help keep their children mentally healthy during the times that we are in right now with the COVID and the restrictions that come with it? So, which I think you just touched a little bit on that too.
Sure.
Yeah, but do you have any other tips that you may give?
Yeah, so I think it's really important, first of all, to create a schedule that is sustainable for your family. It doesn't have to be scheduled down to the minute, but if that means that every night at 7 p.m. you guys sit down and play a board game together, or you do something as a family that your kids can predict and rely on, that kind of predictability and reliance in the midst of all of this chaos is a shining example for them of the calm within the storm. And that's an analogy I really like to use, because it fits for just about anything. It fits for your teenager going through puberty. It fits for your 2-year-old having a huge meltdown. Is regardless of what your child is experiencing, you being the calm in the middle of that storm sets the example for them. It's one of the most challenging things to do as a parent, and I recognize that that's hard, because it's hard for me to practice what I preach sometimes. But being able to take a deep breath, calm yourself, walk away from the situation if your child is upsetting you, and responding in a way that is not going to give in or give a big explosion is really important for that consistency. I think another thing that we miss is the blessing of the ability to work in some social and emotional skills now that kids maybe aren't in school full time, or you do have more time at home. So that can be things as simple as emotion conversations and emotion labeling for little kids. So if you have a 2-year-old and they're crying, you might say to them, "You look sad. Tell me why you're sad. You look angry. I can see that I'm frustrating you right now." Using those emotion words help kids to recognize and internalize the feelings that they're having so that they can use those words with you later. So that's a good step for little kids. For the early elementary to middle elementary age students, working on things like taking a deep breath, working on kind of relaxing your muscles or dancing, other activities that you guys can do, or learning how to take a break when you're feeling upset with your brother because he took your toy. There's lots of really great workbooks out there that are on Amazon. I'm happy to provide resources, but there's a book called The Angry Octopus that I really like that teaches kids how, when the octopus was really upset, he learned how to relax his muscles. For your teenagers, it might mean just sitting down every day at dinner time and having some raw emotional conversations, explaining to them that you're struggling with something, and how you're coping with it so that you can model that for them. And then monitoring their social media, monitoring the things that they're doing kind of when they're in their bedroom, so that you can understand how to better help them and how to provide resources to them if you need it. So I think that this is an opportunity that we can take as parents to start to teach social, emotional, and kind of our children's self-help skills that are going to last way longer than the education that they're learning in school. You know, these are tools that a lot of kids don't learn in school, and if we can equip them with them now in this really tough year, then hopefully that'll help them to be able to thrive as they get older, which is always our goal as a parent.
Dr. Wallace, I appreciate you being on with us. It's been great. I've learned a lot. It's been very interesting and helpful as well. So I greatly appreciate that.
Sure. Thank you so much for having me. And if there's anything that I can do to help in the future, we also have a packet that we send out to families and a website that we've created that I'll send you. If you have things that you want to add to that or can help us with resources across the state, we would love to add those and be able to provide that support to families too. So I'd love to partner and do whatever we can to make sure we're helping families in your area too.
All right. Yes, absolutely. We can do that.
Cool.
The Circle of Parents group. To find out more, please visit our website at www.cedwvu.org.